Anyway, my name's Dr. Haden. I'm here to talk to you about stereotactic breast biopsies. Stereotactic breast biopsy is a less invasive way to determine if an abnormality on a mammogram is benign or cancerous. Excluding cancers of the skin, breast cancer is the most common cancer among women, accounting for nearly 1 out of every 4 cancers diagnosed in American women. Are you at risk at getting breast cancer? Every woman is at risk, and even some men. According to the American Cancer Society, if a woman lives to be the age of 85, her chances of 1 in 8. So it's a fair development in breast cancer, a fairly common disease. Age is a major risk factor. A woman's chance of getting breast cancer increases with age. Next slide, I think. Okay. Here in this slide are the age-specific probabilities or odds of developing breast cancer as a woman. And as you can see, it's at age 20, you have a 1 out of 2,000 or 1,700 chance, and as you get older, it goes up to at 85 is 1 in 8. Luckily, or fortunately, these odds are getting less as more technologies develop. Besides age, there are other factors increase the risk of developing breast cancer. Having a personal history of breast cancer or ovarian cancer increases your risk of having a cancer in the other breasts. Having a family history of breast cancer, having a previous biopsy showing atypical hyperplasia or carcinoma in situ, having your first period before age 12, starting menopause after age 55, never having children, having your first child after age 30, some genetic factors, drinking more than 1 alcoholic drink a day, and being overweight after menopause or gaining weight as an adult increase your chance of getting breast cancer. Remember, there's no one cause of breast cancer. There are more than 2 million breast cancer survivors today in the United States. 89 out of every 100 women whose breast cancer is detected early will survive without recurrence for 5 years. And that's, in other words, nobody wants to get cancer, but breast cancer is one that's well treated, and the medical profession can do a lot to keep it in remission. There are certain circumstances that can affect the chances of survival if diagnosed with breast cancer. 5 years seems to be a magic number, and some. If you're cancer-free after 5 years after your diagnosis of breast cancer, chances are that you will at least chances are that you won't die from the breast cancer until you reach the age of 85. The stage of cancer which is diagnosed or how advanced the cancer might be affect survival. Black women are less likely than white women to survive after 5 years. This is attributed to advanced cancers at diagnosis. More black women have more advanced cancers at diagnosis lots of times. A lack of health insurance also has been associated with lower survival rates. Can breast cancer be prevented? No. However, it can be successfully treated when detected early. If you can find breast cancer early, there's a better chance of survival. Studies have proven that early detection of breast cancer increases the various options, how to treat the cancer, the success of the treatments, and increases your chance of survival. There are 3 basic screening methods that are used to look for early breast cancer. Breast self-exams, clinical breast exams done by a doctor, and mammography. A woman should perform a breast exam every month and try to do it at the same time of the month because your breast changes as does your uterus when you're going through your period. Most breast lumps are not abnormal. They can come and go with the women's menstrual cycle. However, any unusual or new or persistent breast lumps should be checked by a medical professional. Mammography is the best method for diagnosing breast cancer in its early stage. A mammogram is an x-ray of the breast. 1 out of every 50 mammograms taken shows some sort of abnormality. The abnormalities can range from small deposits of calcium or microcalcifications to small masses or lumps that cannot be detected by palpation or by physical exam. Women over the age of 40 should have a mammogram every year. If you have a history of breast cancer in your family, you probably should have a mammogram starting around 35. Although the mammography equipment today has improved tremendously, we now have digital, in fact, computers reading the mammogram or screening for abnormalities on the mammogram. The only real way of finding out whether a lesion on the mammogram is to take a piece of that lesion and have it looked at under a microscope by the pathologist. And that's called a biopsy. 80% of breast biopsies performed turn out to be benign lesions, which is good news. If a woman presents with a specific cluster of microcalcifications, which is what this little circle shows on her annual mammogram, these calcifications could be an indication of early breast cancer. And they need to be usually taken out and biopsied and looked at under a microscope. What is a breast biopsy? A breast biopsy is removal of breast tissue from within the breast so it can be examined and evaluated and diagnosis can be made. A breast biopsy is usually indicated if a lump or other abnormality is found during self-exam. A lump is found during the examination by the physician, or abnormality shows up on your mammogram. Sometimes if abnormality shows up on the mammogram, the radiologist will ask for more pictures so he can better tell whether it's benign or needs to be biopsied or not. You do have options about what kind of biopsy to have. There are 2 major types of breast biopsy methods, invasive and minimally invasive. The invasive method is surgical, and what usually happens is you go over to radiology and they numb it up and stick a needle where this place is in your breast, and then you go to the operating room and the doctor makes a cut where the needle goes in, traces down the tip of the needle and takes out a section of breast. The non-invasive way is it's called the stereotactic biopsy. And it's minimally invasive biopsy are performed through your skin and not making a big cut. And after the biopsy, you can immediately resume your daily activities. There's minimal scarring, and it's also less expensive. It's not a 2-step procedure like the open biopsy. And 80% of all biopsies are benign. The stereotactic procedure, the patient is positioned like this on the stereotactic table on her stomach, and the breast to be biopsied hangs through a hole in the table. Underneath the table is basically a fancy mammogram machine. The breast is compressed, but not as tight as the mammogram is done. And this stabilizes the breast for the procedure. It's very important the patient doesn't move during the procedure. X-rays are taken at different angles, usually at 0 degrees and 15 degrees from the center to get, and that allows the computer to figure out exactly where it is in the breast. That's why it's called stereotactic, because you're taking 2 angles of X-rays. Once the area to be biopsied has been located, the doctor prepares the area for biopsy by cleans the skin with an anesthetic cleaner and numbs the area. The numbing medicine hurts for about a second or 2, and after that it's usually not too painful. However, I of course never had one on myself, so, but most people it's a lot less painful than having a big cut on the breast. Procedure takes about 30 minutes, and the actual biopsy itself takes about 2 minutes. The technologist and doctor confirm that they are on the, take some X-rays, confirm that they're in the right position, or the needle's in the right position, and they actually fire the needle, which moves it about an inch in further, and so it doesn't move the calcium out of the way. The probe is advanced and fired, and what happens during the actual procedure is there's a little cutout here of the needle, and it sucks breast tissue in and then cuts across there. Then the needle turns, so you end up getting a section of breast sort of in a cylinder that's about an inch by half an inch big, and then the tissue comes out the back of the needle, and then we X-ray the specimen that comes out and make sure the calcium that was in your breast is now in that specimen container. The images here show we take X-rays after the procedure to make sure that the calcium's gone and that have end up a little cavity there where the biopsy is actually taken. And then we X-ray the specimen, which is this. These calcium areas that were in your breast are now in these specimen containers. It usually takes about 3 days to get the path report back, and it's a very accurate test. After we do this, we place a little marker that goes through that needle, and that stays in your breast forever. It's microscopic, you can't hardly see it, but it does show up on a mammogram. And if this turned out to be a cancer, or a little area of cancer, then the doctor with that marker would know exactly where the breast cancer was and what location of the breast, and be able to treat it better if you need to have a lumpectomy. Any questions? That's my little speech about breast biopsies.